technically demanding answers, and I will furnish those answers presently. If you do have any questions of your own, then you're welcome to post them to me. And if you have asked any of these questions I'm going to talk about, then you're welcome to come back at me if you feel that I haven't explained it properly, or there's something that you'd like to know in more detail. So I'm going to start with this question here, and the reason I'm starting with it because someone's just asked it this afternoon, and so I think they said that I would talk about it tonight. So with a nipple reduction, do you reduce width and length of nipple? So first of all, just to be clear what we're talking about here, it is a nipple reduction, which is not a particularly common procedure, as opposed to an areola reduction, which is more common. So the nipple areola complex comprises of an areola, which is the pigmented skin around the nipple, and the nipple, which is the bit that sticks out in the middle. So it's more common for people to want the areola to be made smaller. So it's not that common for people who want the nipple to be made smaller. So as I say, the nipple is the bit that sticks out in the middle. And however, it is a thing. Some people do want nipple to be made smaller, and it is possible to reduce the size of a nipple. And the normal way to reduce the size of a nipple is the nipple is kind of like a dome. And you take a slice of cake out of the dome, you take a segment out of the dome, and then you sort of close it down to reduce projection. So normally it would be the projection that's reduced, because normally that is the problem. It's protruding too much, it sticks out too much. And so it is the sort of length, I suppose, of the nipple that's reduced, as opposed to the width. So, but if you're specifically asking, could the width be reduced? Well, then I guess it could. You could take a wedge out from the width to make it a little bit narrower. So I guess it's possible to reduce the width of the nipple, but usually it is a wedge to reduce the projection, the length of the nipple. And it's a little bit fiddly operating on a nipple, as you might imagine. And so it's quite hard to reduce sort of width and length. Having said that, if the nipple's very large, then it will be easier. So if the nipple's clearly got too much width as well as length to it, then you could take a slice of cake out that way to bring it down, and also a slice of cake to sort of make the width smaller as well. So it would be possible to reduce the width. But it's one of those ones where you probably have to examine you to see how big your nipple is, to see whether it's actually a goer that we could actually reduce the width, because you kind of want something. Because if there's nothing there and it's flat, it might look a little bit odd. So you kind of want something. So as I say, normally it's a width of nipple. It's a length of nipple procedure, or projection, if you like. How much the nipple projects, how much the nipple sticks out, is kind of the normal thing in terms of nipple reduction surgery. Having said that, one of the things about plastic surgery is there's often things that we're pretty flexible and adaptable, and if it can be done, we can do it. So what we would probably do is talk it through with you, to see whether that would be something that would be, first of all, possible. As I say, if the nipple's quite small, it's not going to be that possible to reduce the width. But if it's possible, yes, we could potentially reduce the width for the nipple. So yeah, interesting question that. Have we got? I have a consultation with you next month. Can't wait. Oh, Kirsty, that's okay, Kirsty. Good. Looking forward to seeing you next month, Kirsty. So don't get your questions here now, because otherwise we'll have nothing to talk about next month. So save them up. No, you can ask questions if you want, but that's good. Looking forward to it. Next month, not that far away, is it? It's only it's a couple of weeks. Anyway, see you next month, Kirsty. Can you assess a lump or mole via photography? Obviously, not obviously, but we do, because one of the sort of things that we do is we say send us a photo on WhatsApp, and we can give you an idea, an assessment. in terms of how much it's going to cost to remove. Certainly moles, I guess, is a little bit easier than lumps, kind of like cysts, lipomas. They can be difficult to assess because often it looks pretty normal. I mean, cysts are usually right underneath the skin, so they can sometimes tent the skin up, so they can be a bit more obvious. But certainly cysts in the scalp and what have you are often difficult to see. And lipomas are often a little, or can be a little bit deeper, and so they don't tent the skin up so much. So often it's kind of hard to see where it is. But sometimes you can get an idea of where it is, and it's useful to us to see sort of what part of the body it's on, and if you can kind of circle the area where it is, you can get a hint of how big it is. So yeah, you can get an assessment to a degree. It's never as good as a in-person consultation, but it's a start, and so yeah, you can get an idea about lumps, moles, and things like that on a photograph. So it's definitely a start, but there is no substitution for a history, like hearing the story. Sometimes people just send us a photo. It's nice to hear a bit of a story. This lump's been present for 3 weeks and it's getting bigger. This lump's been present all my life. This mole I don't like the look of it, or this mole's got darker recently or started itching or bleeding. If there's a bit of a history, it can kind of help us to make an assessment. So it is always useful to have a little bit of background on, first of all, where it is, because a lot of people send photos really zoomed in and you can't tell where it is on your body. You can't get an idea of scale. So, if you need to zoom in to show the thing, zoom in, but then maybe send us another photo zoomed out so we can see if it's your arm or your leg or your head or your eyelid or whatever it may be. But yeah, we can definitely give you an idea on photographs, but it's not the be all and end all. We would need to examine you to give you a kind of proper assessment, but hopefully we can give you some helpful advice based on photographs. Do I need a referral from my GP? Hold on a minute, there's a question there from Kirsty. Do I need a referral from my GP before coming to your clinic? Kirsty, I'll get to you in a sec. We'll do that question. Good question, that one. No, you don't. So we do not need a GP referral. We are happy to see you directly, so you can give us a ring, send us an email, whatever. If we do see you, we do encourage you to let us write to your GP. So I would routinely write to your GP to let them know what's going on, because it's good to keep your GP involved, but we will ask for your permission for that, because we have to ask permission if we're going to share that information. But it is good practice to let the GP know what's going on. Obviously, if you're not going to go ahead and have anything done, you might say, look, there's no point, which is, that's up to you. But, the default position is that we will write to your GP to let them know that you have attended and what's been said. But you don't need to see your GP prior to coming and see us. I always think it's a bit of a waste of time. Certainly for the stuff that we do, people usually know they've got a mole, a lump, a cyst, or there's something, there's something they want to get fixed. They kind of know, so it's a bit of a waste of the time to say go to your GP to get an appointment, because I feel that's a bit of a waste of an appointment with a GP. So yeah, you don't need to see your GP, but as I say, we will write to them to let them know that you've been. What you got, Kirsty? So Kirsty, consultation on the 11th. What are the best implants? So Kirsty, what are the best implants? Well, I can answer that very simply, Kirsty, to say that there's no best implants. There's lots of different implants out there, and if there was a best, we would all use it. Kind of no question, really. I think we would all use it if there was a best. I don't think anyone would use an implant that wasn't the best. If there was a sort of proven best implant, that would be, they would dominate the market. But fact of the matter is, no implant does dominate the market. There are certain surgeons who use certain types of implants and can justify those, and that's perfectly fine and reasonable. And there are certain surgeons who use other sorts of implants and can justify those, and that's perfectly fine and reasonable. And sometimes, Kirsty, I think that's actually more helpful to patients when surgeons do have certain implants that they use. And I think I'm safe in saying that is the general the standard situation is that most surgeons will have a type of implant that they like and use, but I don't. I will use them all. Well, I have got views on it, obviously, but I use all of the types of implants. I am not. I don't work for a company. I don't work for any sort of organization, so I'm not kind of linked to a certain implant manufacturer. I don't have to use a certain make of implant, and often I'll see people who say, "Well, this is the best type of implant, isn't it?" And it may well be that they've seen a surgeon who works for some company or something like that, and that company only uses a certain make, and so they are saying that that make is the best. And I'm like, well, I'm not saying that makes bad. Often the make's fine, but it's not the best because there's this other one which is better for these reasons. Now, the one that you've been told is the best is better for those reasons, but this one's better for this reason. So, there's pros and cons. That's the problem. That's life for you. And there's so much to talk about when you talk about breast implants. Sometimes I've got to be honest, it's a lot to be said for just saying, look, this implant's the best, have this one. And you'll be like, okay. The problem is, particularly in this day and age, if you get a problem, which you might not have got if you've been offered one of the other types of implants, you might quite rightly then feel aggrieved and kind of complain about that. Say, well, hold on a minute, they never told me about the other type, and I've got this problem now. So therefore, I tell everybody about all the different types, the pros and cons, and I do have a view myself, but at the end of the day, I'm happy using all of them. I have used all of them, and it's up to the patient to really have a sort of final say so on what the implant that they want. And broadly speaking, just to keep it simple, in terms of time, because I don't want to ruin all the discussion we're going to have when I see you next month. But broadly speaking, the range of it, the differences of implants. Most of the implants we use in this country is silicone gel inside. So they make saline ones, but we don't tend to use saline implants in this country. So pretty much all the ones we use in this country are silicone gel. So they're all the same inside. And so broadly speaking, the difference is in the shell. They have different shells, and some are completely smooth like glass, and some are really rough like foam. Some have got like a sponge of foam coating. And then some are in the middle of that. Some are just a bit rough, not quite as rough as a sponge, but rougher than the smooth ones. And they're called textured. And there's kind of micro and macro textured. We won't get into it. So basically there's completely glassy smooth ones, and there's really foam rough ones, and there's a little bit sort of textured ones in between. And the really rough ones are good because they don't go hard. Capsular contracture, which is something that happens over time with implants that makes them go hard and gets uncomfortable, and they can get unsightly. Usually takes 5 or 10 years for it to happen, and so that's a problem with implants, something called capsular contracture. And the ones that are really foamy and the ones that have got the rough coating don't go hard. So the ones with the kind of sponge foam are the least likely to go hard, and the ones which are textured, so a little bit rough, are less likely to go hard than the smooth ones, but more likely to go hard than the foam ones. So the rougher it is, the less likely it is to go hard, the less likely it is to be needed to be changed in the future. So that's a good thing about the roughness, the rough ones. Now I could just leave it at that and say, oh, the rough ones are the best because they don't go hard. And, there's lots of people who just use the rough ones. And I do think they're very good, the rough ones, because they don't go hard. But if I just said that, there must be something bad about them, because if there wasn't something bad about them, why do some people use the completely glassy smooth ones that go hard, and they also ripple and stuff like that? So the smooth ones, so I don't want smooth ones because they ripple and they go hard, and you'd be like, okay, I'll have the rough ones because they're the best. Well, obviously there is a downside, and the downside, I guess the easiest thing to say is there's a couple of issues with both, but to keep it simple, there's a cancer called ALCL, extremely rare, but it's related to the roughness of the implant. So the really spongy, rough ones have got a higher rate of ALCL. The slightly textured ones has got a sort of medium rate of ALCL, which is the cancer, and the smooth ones don't really get the cancer. So that's why a lot of surgeons will say, I use smooth ones because they don't get the cancer. And you say, crikey, that's brilliant. I must have a smooth one because I won't get the cancer in that case. But you're more likely to get it to go hard and more likely to get rippling. So yeah, basically that's it. So there's good and bad about both. And you could kind of sell one or the other. Obviously, the cancer is a very emotive thing. You think, crikey, O'Reilly, I don't want the cancer. Well, no, obviously you don't want the cancer. No one wants the cancer. But if you put it into perspective, it's extremely rare. It's curable in the majority of cases. And so, the risk actually is not huge. And so you've got to balance it against the risk of having a capsular contracture, requiring another operation for the capsular contracture. Then that can then cause another capsule straight, quicker when once you've had a second operation, you get a capsule quicker each time. So there are issues with both. I'll be honest with you. There's not both. There's different types: the micro texture, the macro texture, the smooth, the foam ones. There's issues with them all, is the answer, and there's benefits with them all. So there is no best, is the bottom line. And anyone who tries to tell you that they're using the best, if they're saying, well, why does the other guy use this one? Whatever they're using, whether they use micro textured ones or the polyurethane ones or the smooth ones or the macro, whichever one they're using, why is the other guy using the other ones? And that's that's the question to be had. So yeah, I use them all, and I do sometimes think that makes it more difficult for patients because I kind of give you the option, but at the same time, I'm just trying to help you make an informed decision, and I will help you, and I will kind of try and help and give you my view on it. But as I say, I've used them all, and I do currently use them all. I'm comfortable using them all, it comes down to your view really on your risk profile, basically, and that's the difference with the implants. It's not the look of them. So the way they look is not different. So when you look at someone, you can't tell what sort of implant they've got. So this is all about the risk profile for the future. So you can't tell if someone's got a polyurethane implant or a smooth implant or a textured implant by looking at them. So the look is the same, whatever. I mean, there are risks with them not looking right with all of them, but if you get it right, or if they look right, they'll all look the same. So so welcome to my world. That's what we're up against. It's not black and white, but I will do my level best to work through it with you. And the other thing I always say to everybody, and I'll say this to you, is you don't have to make a decision on the day, because when you come for a consultation, it can be a bit daunting when you start talking about all this stuff, as well as goodness knows all this stuff about the shape of the implant, the projection of the implant, and all this other stuff you've got to talk about under the muscle, over the muscle. There's all sorts of stuff going on, and so it is a bit intense, shall we say. So what the best implant is, there isn't one. They're all good, they're all bad. There's good and bad about it. It's a bit like saying, what's the best car? What's the best watch? Now, if I sell Casio, I'm going to tell you the Casio's the best, aren't I? Because they've got a calculator on them. They've got a flipping battery that lasts all time. They're very reliable. Best watch you can get. Casio, fantastic. Let's get a Casio. But that's because I'm a Casio salesman, isn't it? If I'm a, what the hell was that? TikTok just made a noise. Right. Something's happened on TikTok. Okay. God, that's terrifying. If I'm a salesman of a Seiko, then I'm telling you Seiko's the best. But the answer is, if you're what's the word? Unbiased. What's the word for that? You get financial advisors, independent financial advisor. Yeah. If I'm one of them, then I'm going to tell you, well, Seiko's good if you want whatever Seiko's good at, and Casio's good if you want the calculator on it and the sort of day-date function. Some people want calculators on the watch. Casio's the one. You don't want a calculator, and you want it to look sort of classy. Then it's something else, isn't it? And then it's Rolex if you want it chunky and it's Rolex then, isn't it? So it's a best. There is no best. If you're a salesman of one, yeah, I think we've clarified that. Okay, good. Thank you, Kirsty, for that. That's a good question. What we got? Sarah's got something here. Hi, JJ. You removed my mole last Monday and I had my stitches out yesterday. All good. Just wonder if it's okay to start using my LED mask again yet. Thanks, Sarah. LED mask. LED mask. So, what do your LED masks do, Sarah? I mean, obviously, light? A light mask? Oh, heck. I mean, it's not a tanning thing, is it? I mean, the only thing you've got to worry about is tanning. So it's not like UV, is it? Is it like LED? Is it like sort of to make you feel better because it's got light in it? God, Sarah, I wish I could have Googled this. I mean, you don't want to get like UV on your scar. So if your scar's a bit red and active, you've got to be careful in the sun and all that sort of stuff. Did I give you some tape? If I gave you some tape, you can put some tape on it to cover the scar. That might be the answer. Oh, yes, from Boots. It's UV. Oh, not UV, not UV. Okay, okay. Well, if it's from Boots, Sarah, then we're on a reputable. Got a reputable. Distributor. Yeah, I mean, what's it for, Sarah? Is it kind of like light therapy to make you feel better? Supported to boost collagen production in us older ladies. Okay. Support collagen. Yes, I have tape. I'm just a bit anxious, Sarah. Last week, it wasn't that long ago, was it? It's a week ago. Your scar's going to be all red. I would say probably, but is it? Well, let me put it to you. Is there any? There's no harm in putting a bit of tape on, is there? Because it's not like it's going to tan you. So I would probably cover the scar because I don't know. I'm not sure about this LED thing. Does it help? Does it help your collagen? Have you found it helps? Maybe put a bit of tape on, Sarah. That's my final answer. Put a bit of tape on, and yeah, if you don't mind. If you do mind, it's probably okay. But if you don't mind, I'd say put a bit of tape on, just to be sure. Sorry, Sarah, I'm not familiar with the LED mask situation, but sounds good. Maybe I should get one myself. Is it just for older ladies? What about anyway? Have we got a question? That's all right. What? See, I've got a white t-shirt on, so it's not helping here. We got a question. Sent morning. Just sent a gift. What the heck is going on? I sent a request. Official. All right, someone wants to join my live. What's this? Official desk tag sent you a request to accept me to join your time. People do that all the time. Official desk tag. I usually ignore it. To be honest, I usually assume it's a mistake. Where is it? Invite. What can I do in preparation for my tummy tuck consultation and surgery with you? Okay, questions coming out. Okay, I didn't hear the first part of your answer. What do you think about wearing farja after surgery? Okay, I don't know what farja is. What's farja? What can you do to prepare for tummy tuck? Okay, what can you do? Get in shape. Get your weight right. Really important to get your weight right. So get stable and comfortable with your weight. That's really important because you don't want to have weight fluctuations after surgery. You might, if it's with me, I hope you don't smoke, do you? I'm hoping you don't smoke because I'll be honest with you, I probably wouldn't do it if you do smoke. It's just not worth doing if you smoke. So don't smoke. Get your weight right. Good diet. Prepare for a good diet. Post-surgery, you have to be aware that you're going to have a big wound. You need to heal, so you have to think about protein, things like that. Fresh fruit and veg, you have to keep yourself regular because constipation can be a problem after a tummy tuck. And positive mental attitude. I genuinely believe that is really important. And I know it sounds a bit wishy-washy and a bit not very scientific, but I do believe that being positive, thinking it's going to go really well. I mean, obviously we have to talk about the complications and stuff like that. You have to sign a consent form acknowledging all the bad things that are going to happen, and goodness knows there are bad things that can happen with a tummy tuck. But once you made the decision to have a tummy tuck, so that all needs to be discussed in order for you to make a balanced judgment on whether a tummy tuck's right for you. But once you've made the decision to have the tummy tuck, I think it's really important to be positive, not focus on the negatives, focus on the positives, positivity. As I say, fresh fruit and veg, it can be difficult because if you are getting in shape and you are getting trim, it is difficult after a tummy tuck because you will be knocked back for a bit. So getting in good shape beforehand will sort of prepare you for that. And then after a few weeks, you can start getting back into it. I don't know what a far jar is. Far, unless that's so you can tell me what a far jar is. And if you wanted, who wanted to join the live? If you want to join the live, you want to set an official desk tag. I don't know how I allow you. You're welcome to join me. Official desk tag. If you want to join me. Number one, I don't garment. Body sculpting garment. Yeah. So is that what a far jar is? So yeah, we'll give you a garment. If you've got your own garment, great. Yeah, if that's what a far jar is. So yeah, a garment. You will wear a garment post-op. We will give you one. And St. Rambo headband. What? So you will need to wear a supportive garment post-operatively. And I stress that word supportive. A lot of people talk about compression garments. I use the word supportive because you don't want it too tight. You don't want it sort of compressing. You don't want to take it off and think, oh my God, I can breathe now. You've got to be able to breathe. You don't want to compress the abdomen too much, but you need a bit of support because it can swell and it can be a bit uncomfortable when you have a tummy tuck. We will put a garment on you in theatre, so you will wake up with a garment on. But if you find that garment's uncomfortable and you have your own garment, or sometimes people wear those big pants, those big pants, maybe that's what a far jar is, I don't know, those big pants that sort of hold your tummy in, they're fine as well. So don't feel like you have to wear our garment. If our garment's uncomfortable and you have your own garment or something that you would prefer, then by all means wear that. It's just something to help with the swelling and to give you a bit of support. So yes, that is important, and we normally say for a month, day and night post-operatively. Sometimes people want to wear it for longer than that, but that's kind of like at least a month, day and night, just to help with the swelling. It will be swollen for a few months, to be fair, but certainly in the hot weather and stuff, you might think, oh my God, I've got to get this garment off. So you don't have to wear it for that long if you... Oh, here we go. Ollie, look, someone wanted to comment. Oh, it just flashed up. It's gone now. Do you put it on right after surgery for us? Okay, great. Yeah, we put it on. We put it on right after surgery for you. But the other thing I would say to you, and I'll probably say this to you in the hospital, is we put it on you, but if you kind of wake up from surgery and you find we put it on tight or loose, don't feel that we made a judgment when we put it on. If it's tight or loose, you can adjust it. So you can put it on tighter or you can loosen it off. Sometimes people think, I better keep it on the same sort of setting that it was on when I came out of theatre because that's the way they put it on. We just kind of put it on. So if it's too tight or too loose, you can adjust it yourself. Similarly, in the first few days and weeks after surgery, you can get swelling and the swelling can go up and down. So you can, by all means, feel free to adjust it if you find it's uncomfortable. So yeah, that's good questions there. Thank you. What happens when you're an influencer trying to keep track? Yeah, use tape. Well done, Sarah. You can use a tape. What we got here? Can I remove multiple? Can I remove multiple lumps in one session? Yes, you can. What I'm thinking we're talking here is lipoma, which is kind of the usual multiple lump type thing. Usual. I mean, sometimes I have people have multiple cysts and stuff, but really multiple. Some people have loads of lipomas and stuff. And I saw someone the other day, and we sort of 10 is kind of like, well, it depends on the size, obviously. But 10 is kind of, I would say, max, because we certainly under local anaesthetic, because we're limited as to how much local anaesthetic we can give you. So I would say 10 is going to be max. If they're bigger than that, it'll be less, because we'll need more local anaesthetic, and as I say, we don't want to get past the toxic dose of local anaesthetic. And if you really want a lot removed, like more than 10, for instance, then you'd be looking at general anaesthetic. So under general anaesthetic, you're less limited as to how much you can remove, and you can remove many. I think I removed 200 from someone once, but I'm not suggesting we should do that. But you can remove loads. If there's loads of them, you can just remove the loads if it's under a local a general anaesthetic. But under local, there is a limit as to how many in one session, simply because of the toxic dose of local anaesthetic. Because often, certainly if they're small, if they're close to the skin, they come out quite easily. But obviously, each incision needs to be closed, and it'll take time and stuff. So, yeah, the answer is yes, you can remove multiple. I would say 10 is a kind of ballpark for local anaesthetic. If they're bigger, if there are some bigger ones, then it would be less than that, because of the amount of local anaesthetic we can use. If it's under a general anaesthetic, then that limit is then opened up, so we can do more than that if it's a general anaesthetic. Surgery for us. Okay. Right. Okay. Sorry. Just checking. I haven't got any questions from my followers. No. Okay. My followers haven't got any more questions. How do I know if a mole needs removing? So the first thing about a mole needing removing is there something worrying about it? So that's something that we can help with. That's why photos are helpful. Examining it, taking a history, changing mole, bleeding, itching, changing in color, changing in shape, changing in size. So if there's a mole that's changing, that you are about it being cancerous, then it's worth removing it and getting it looked at under a microscope. If it's troublesome, if it's raised, if it catches, if it annoys, then you might want to have it removed. You don't need to have it removed. And so I would say so how do I know if my mole needs removing? Well, that's the first part of what I just said then. If it's changing, if it's suspicious, if it's in an area that's difficult to monitor, the back, for instance, if you've got a history of having abnormal moles or dysplastic nevi, as we call them, then you kind of be a bit more high alert of being concerned about moles. And so that would be the criteria for a mole needing to be removed. Suspicious features, changes in size, shape, color, symptoms, bleeding, itching, halo, satellite lesions, things like that. That would be required. So all other moles don't need to be removed. They would then, if you want to have it removed, so that would be if it's functional problems, it's raised, catches on your hair, or it's shaving or whatever, or don't like the look of it, sort of thing, then that would be need to have that removed. But if you want to have it removed, you can. So the need would just be if you're worried if it was a skin cancer, basically. What's the difference between a cyst and a lipoma? Right, well, both of them are lumps underneath the skin, and the difference, bottom line, is slightly academic. I wouldn't kind of worry about it too much, because it doesn't really matter that much, because the treatment is the same. You cut them out, and sometimes, we're not sure whether it's cyst or lipoma. Sometimes it's not obvious which one it is, and it kind of doesn't matter, really. But there are differences, and there are kind of ways you can tell. So a cyst is at least a sebaceous cyst is a lump in the skin. So it's actually a lump in the skin. Both of them, the overlying skin is normal, but a cyst is kind of attached to the skin. So that's what I mean. A cyst sometimes bumps up the skin because it's right underneath the skin. And sometimes there's a little hole, it's called a punctum, which is associated with the cyst, which kind of connects to the outside world. And when we make the incision to take the cyst out, we usually take that little punctum out. So a cyst is a lump which is kind of within the skin. Sometimes they can be infected, sometimes they can discharge. They're kind of filled with this sort of soft material. A lipoma is a fatty lump which is underneath the skin. So strictly speaking, you should be able to move the skin over a lipoma, whereas a cyst will move with the skin. Now, sometimes it's difficult to tell if it's all like quite close by, but strictly speaking, the lipoma is underneath the skin, so the skin is independent of the lump, whereas a cyst is kind of is part of the skin. And so a lipoma doesn't have a punctum, doesn't have any connection. And one of the main differences is a lipoma can be deeper. So a lipoma is sometimes right underneath the skin, but it can be underneath the muscle, underneath the fascia. It can be quite deep. So a cyst, when you cut the skin, the cyst is right there. But a lipoma, sometimes you cut the skin and there's nothing, there's subcutaneous fat, but there's not. It's like, where's the lump? So you have to go down deeper and try and find it. So that's kind of one big difference in a cyst and a lipoma. So certainly in areas where there's a lot of space, like in your tummy or certainly over the spine and things like that, you worry a bit it could be something else. So that's where we need a scan to see, first of all, if it's something else, but also see how deep it is. Because we don't want to do something under local anesthetic and then cut the skin and find out there's nothing there, and we have to go deeper to find it. So it's can help delineate how deep a lipoma is. So lipomas, as I say, they can be underneath the muscle and they can be quite deep, which can be a little bit more difficult to remove than a cyst. But the flip side of that is, if it is a deep lipoma, then usually it doesn't bother you that much because you can't feel it because it's deep. So usually the troublesome ones are a bit more superficial. So if it's a lump that you feel and that bothers you, it's likely to be more superficial lipoma. But still, a scan can be helpful to see how deep it is. Can you remove a cyst if it's inflamed or infected? Can you or should you? That's the question. So can you? You can do a lot of things. Should you? No, you shouldn't. So it's just not good. If it's inflamed or infected, then it's not good practice to remove the cyst. And we often get people who are a bit desperate, really, and it's all inflamed and it looks uncomfortable, and it's, please help me get rid of the cyst. And actually, it's just not good practice to do it when it's inflamed and infected for two reasons. First of all, the local anesthetic doesn't work. Because in the area of inflammation, and it's just, sometimes I've ended up doing surgery. In fact, I did one the other week where it didn't actually look that inflamed, but when I did the surgery, it obviously was, because it was like an abscess, and it was just a bad situation. It was only tiny, but it just kept on having to put more local anesthetic, and it wasn't very comfortable. So it's not great doing it on infected cases. But also the wound that we create is more likely to get infected. So we're going to make a wound when we do a cyst removal, and that is more likely to get infected in the presence of infection in the skin. And the actual wall of the cyst, when you do the surgery, you want to get that cyst wall out, and you want to have a nice, like, marble or whatever it is come out. And when it's infected, it's all soft and it's all like mushy. It's all mushy. So there's no nice wall to remove, and it just comes out in bits. And if it's coming out in bits, you can't tell that you got a whole cyst out, and so it can come back. If you don't get all of the cyst wall out, it can come back. So it's much more likely if you try and do it when it's infected. So it's not nice surgery to do. Local doesn't work very well. The wound is much more likely to get infected, and we're going to give you a scar about the size of your cyst. So, and if that gets infected, that won't give you as good a scar as you'd like, and it's just not going to be great. And it's really hard to convincingly get that cyst wall out. You're much better off doing whatever needs to be done to get rid of the infection, whether that be antibiotics. Sometimes they lance it, let the evil humours out, whatever. And then you think it's gone because all the stuff comes out, but the cyst will remain. So the cyst will probably come back again. But if the cyst wall then comes back again once the infection's all gone and it's all quiet and the overlying skin looks normal, then then's the time to remove the cyst, once it's all quiet and settled down and once the infection's gone. So no, we don't do it when it is infected. It is not good practice to operate, at least to remove a cyst. You can operate on someone when there's infection, but the operation will be involving letting the abscess, opening the abscess and stuff. And that wouldn't be us. That would be a general surgeon who does that sort of surgery. We don't treat abscesses. We only treat the cyst once it's all quiet and settled down. And have I got someone? Do you put it right on surgery? Did someone? I was going to get a live guest then. Who wants to? How do I create a live guest? Who was that? Who wanted to do live guest? I sent you a request to accept official desk tag. How do I? Can I click on you? You are welcome. Let's hit 10k. Right. You're welcome to join my live official desk tag, but I don't know how to facilitate that, because I am not. There's no instructions for this sort of stuff. you become a social media influencer one day, like myself, but there's no instructions on how to use TikTok. No one tells you how to invite someone to be allowed. Where are the instructions for TikTok? Please tell me. It says here, invite Edamika to join live. Does that, are you asking to join, Edamika, or have I got? Are you asking? If you're asking, you can join. I don't know. I'm assuming that's just saying, do you want to join? Yeah. How do you know this stuff? Anyway, clearly he doesn't know what he's doing, but he's doing his best. Okay, it's all any of us can do, and it's all you can ask for. He's doing his best under difficult circumstances. So I mean, if you want to join live, I can invite you. But in the past, what's happened is I end up being in your living room, and then it's all a bit shocking because you're like, "Oh my God, he's in my living room," and so But if you want to join live, I'd be all for it. God knows, someone else talking would be very helpful. Save me the doing all the talking. Anyway, if you want to join live on the thing, do let me know, and I'll join you or do whatever needs to be done. I can Google how do I do that. But without further ado, I am going to bid you good night, and I'm going to say that I am going to go in there and carry on the evening in front of the telly, and I suggest you do likewise. So see you next week, God willing, and have a lovely evening. I'm going to